This is going to be part one of our foot and ankle prep series. So for all the exercises that we're going to show here, these are all going to be double leg from a loading standpoint. We will do some kind of single leg intrinsic work to start. These are all going to be double leg. These are for individuals that are either coming fresh off of rehab, off season, working with someone that really does not have much exposure to the kind of foot and ankle work we're going to do. So it's going to be all isometric base, all body weight, and double leg with a relatively kind of less aggressive, more conservative shin angle. So first thing we want to teach these individuals is how do we essentially create pressure and stabilize through our foot. So what we want to think about is the foot as a tripod. Big toe, little toe, and the heel more than anything. So we want to think about having, when our foot is flat on the ground, equal contact throughout those three parts. So if I'm standing this way here, again, all of this has to be done barefoot in my opinion. All of our calf work, I think, should be done barefoot. I think when you do calf work with a shoe, unless it's a really like minimal type zero drop shoe, it is going to fundamentally change the way that you are essentially creating and absorbing force throughout your foot. Now, in a rehab setting and whatnot, you do need to be mindful of not doing this, you might be using a shoe at first. A perfect example is, if you have someone that has been unweighted for a while, and whether it's after an Achilles surgery or whatever it is, you go right to doing barefoot kind of calf work. It might be a challenge for them. Like they might develop some pain at their big toe because they don't necessarily have the callus and supporting tissue underneath that they would normally get from walking. So be mindful of that. But we want to think about creating that tripod. So big toe, little toe, and the foot here. And what I want to think about is you can hold on here. I want them to get essentially into a single leg stance with keeping their quad engaged, knee straight, their glute is squeezed, and they have that tall pelvis position. So they're not here, they're not here. Then this tall pelvic position. And they're keeping those 3 points of contact there. And this might be all we do at first is making sure they're in that position there. Now, what's going to happen a lot of times for a lot of the patients we see is anytime they're either on their foot here, they're doing calf work, they're rolling onto that lateral board of the foot. So they go up on their toes. So let's just say they're in this case, they go up on their toes and they're kind of coming out. Their big toes are coming off the ground. And that immediately tells us this individual does not have a great ability to likely absorb force, but produce it in the right direction. So where does it go then? It goes upwards to the knee and the hip. So I'm going to, that was in probably the last video. We talked more about the proximal implications, but be mindful of that. So again, we want to think about as cueing what we call short foot. So what is short foot? What short foot is not is this toe yoga nonsense of you just curling your toes like this, where now you are lifting essentially that, the big toe joint off the floor. What short foot is the ability to quite literally shorten your foot. So you want to think about bringing essentially or shortening the distance from the big toe joint to the heel while keeping a relatively quiet toe. So by doing so, if you can see here, I'm literally kind of pulling my arch upward like that. So you should feel some tightening underneath. Again, I am not curling my toe aggressively like that and bringing that joint up off the floor. So that's one thing we want to be mindful of. So that is teaching us how we stabilize our foot there. So again, teach the short foot standing, approximate that area, and then get into this single leg standing position, teaching you how to hold that position rather than just kind of falling into things passively. So now going on to the loading, that kind of phase one loading of the gastroc and the soleus. So we want to make sure we're hitting both. Both are powerful plantar flexors. I think probably people have a relatively, undertrained soleus for certain positions. I wouldn't say undertrained, but they're not necessarily exposed to those ranges before they get into sprinting to a degree. I'm not going to get into the topic of why Achilles injuries are happening or anything like that, but we're going to jump right into it here. So what you are going to need, you can either have a plate, you can have a step. I'm going to use a step for this video, and I have a ball here, which you're going to see. So now we're going to jump into our gastroc and soleus loading. So the first thing we're going to do is just a double leg isometric heel raise. So I have a ball here. The ball is going to go between my heel like so. So what it is not is what we see in posterior tibialis rehab and stuff online, where people go up and they squeeze the ever-living heck out of that ball by inverting their calcaneus or heel there. With this case, I honestly cue people like the ball is just there. I just want you to have your feet close enough where that ball has some pressure by approximating your feet in, and the ball is not going to fall down. So when we go up on our toes here, what I want us thinking about is we are predominantly pushing through the joint of the big toe and the big toe itself. Because what's going to happen is if you either aggressively go in like that, you're going to feel pressure against the ball, which I don't want. Or if you are someone that goes up and you kind of fall on the outside part of your foot, that ball is going to fall out. So again, when we're going here, my big toe is on the edge here, and I am pushing up. And I want you to think about, you're trying to bring that heel, like not literally over the toe, but you're bringing it up towards and over the toe as close as it can be. And again, you're going to find you're going to have to kind of reassess as you're going through your isometric hold. So again, for isometric hold, I'm here, I'm pushing up, and I'm quite literally just holding in that position. That is all that I'm doing there. And I'm making sure I am driving through the big toe more than anything. So that's the first one from loading the gastroc. Now, from a soleus standpoint, what we're going to do, again, this is also double leg. You're going to be here. I'm going to shorten up my straps. I'm going to need a little bit more, or a little bit less length here, rather. And what I'm going to do is I'm going to have both my feet kind of right outside shoulder width apart. Feet are right on the edge here. And I'm going to keep my heels. I'm not letting my heels dip down. I'm going to be in this position here. I'm going to drop down a mini squat, and then from there, I am pushing up through the big toe. And again, soleus is going to be a lot more kind of underneath this area, underneath the calf, and we are just holding that area, pushing through the big toe. Now you might feel some quad, you might feel some glute and hip loading as well, but again, I want you to think about that kind of heel is getting over those toes. So again, these from a phase one standpoint, this is all double leg to teach the position more than anything. If we go single leg right away, it might be too fatiguing for someone to be able to do that. It's all double leg, it's all body weight, it's all isometric. Ideally, we get to a point where you can hold this for a minute, maybe 2 minutes. Maybe you probably can't do that right out of the jump. If you're working on this in season, we have to be a lot more diligent about how we go about implementing that from a duration standpoint more than anything. But those are the three things to work on from a phase one foot and ankle preparation standpoint. We have teaching the tripod, teaching the short foot, and then loading of the gastroc and the soleus in relatively conservative angles.